Hello, I'm Dr. Ghaffari. I'm one of the early pioneers developing IPL technology, and I work extensively with people such as Dr. Patrick Bitter Sr. in developing photofacials, as well as a number of applications that was for skin treatments, including pigmented lesions, vascular lesions, hair removal, and skin rejuvenations. I'm the president of Venus Medical Solutions, and as I look back about 20 years ago, late in 1990s, I did the video training discussing the scientific and clinical applications of IPL technology that I think you will find interesting. I encourage you to see them, and there are different segments that talk about different aspects of the technology, and I hope you would enjoy them.
Or all the fibers are not aligned properly, they usually trap more heat and cause more collagen growth than some other areas. So the three components that we look at in doing photofacials is pigmentation, looking at pigmented lesions, vascularization, looking at vessels, and collagen remodeling. The set of settings that we have here, we have broken it down into 5 sessions. This is a representation of one session. The page includes treatment number, which is session number 1, vertical radiation. On the subsequent pages you will see horizontal irradiation. So let's talk about what is vertical and horizontal irradiation. If someone is standing upright, vertical irradiation means that you will be holding the crystal and rotating about a vertical axis. Horizontal irradiation is when you rotate this crystal as you're doing the treatments about a horizontal axis. Why is it important to do this? What we have found is people who've been doing it for years, after so many years, they start doing the same thing over and over on the face. So typically they place the crystal and they do treatments, and constantly they miss certain areas of the skin. Going with horizontal and vertical irradiation, it forces the operator to change the methodology such that you cover the entire area in certain treatments like this, in certain treatments like this. So you're crisscrossing the treatment area. So that's the definition of vertical and horizontal radiation. The next thing that you will see here is different skin types 1 through 5. And the definition of skin types are also pretty well established. It's the Fitzpatrick skin types. And there is a set of recommendation for number of pulses, pulse width, pulse delay, and filter type up here with an associated set of energy densities. There is another set of recommendation here below, which the number of pulses is 3 pulses with its pulse width, pulse delay, and filter type, and its associated energy density. We've picked out 2 completely different methodology. The reason is when you choose 2 pulses in the top set of recommendation, 2 pulse series usually create most of the heat superficially, and as time goes on and if you need to become more aggressive, you're able to deliver energy in shortest amount of time. The 3 pulse series, the energy associated with them is much higher, approximately up to approximately 20 to 50% higher. And what it will do is it will not only do the treatments of the sun damage and collagen remodeling, but the component of collagen remodeling is enhanced greatly. As a result, if someone has only sun damage, they're not worried about collagen remodeling, then the top set of settings are recommended. And for people who do want to have collagen remodeling, then the bottom set of settings are recommended. There's also another attribute to all of this, and that is, in order to do hair removal, you need energies in the 30 to 35 and above joules per square centimeter. If you intend to do sun damage treatments or vascular lesion treatments, and you do not want to cause hair removal, then you would use the top settings, the 2 pulse settings. And the reason is you don't have enough energy to cause damage to the follicles. You may have some hair that will be damaged as a result of the treatments. However, it's not as extensive as the bottom set of settings, which really go deep, and they do also cause collagen remodeling and certain hair removal. The settings that we have here, there is a range on pulse delay, which is, for example, here is 10 to 14, and the range, the higher range is recommended for people who are just starting out, and as they go through time and they have more confidence, they drop down to the lower number, which is 10. Why do we give a range? As you're doing treatments, there is a probability of causing purpura for vascular lesion treatments. The probability of purpura goes higher and higher as you reduce the total time of delivery. As a result, the range that we have recommended on the higher end, it really pushes you outside the purpura range, so you're less likely to cause purpura. But as you build up more and more confidence and you drop down on the 10 millisecond delays, still you're a little bit outside the range of purpura. However, the probability of causing it is reduced, is increased a little bit. All these settings are designed that you will have exactly the kinds of parameters to give you good results across the board. There's always a special cases. We see maybe about 10% of the patients will have special needs that they do respond to treatments. However, for example, rosacea case is not 100% gone or 90% gone. In those cases, we recommend that you would take the advanced course, which will show you how to push the boundaries on vascular lesion and pigmented lesions and all those treatments. For now, the best way to do is just pick out the protocol that has been recommended, and with the energy, which will vary as after you do the skin calibration, and that in itself will give you good photofacial results. The sessions numbers 1, 2, 3, each parameters for all five skin types will change slightly. Sessions 4 and 5, basically we have one set of recommendation, because in sessions 4 and 5, our main goal is turning from sun damage treatments into collagen remodeling. However, if you want to continue and keep tightening parameters with sessions 3 and on, you can do that and not change the crystal type. The major difference between sessions 1, 2, 3, and 4 and 5 is that the type of crystal we're using is 560 for 1, 2, 3, and it is 645 for 4 and 5. Why do we use 560 for sun damage? Because the components between 560 and 645 are better absorbed by pigmentation and vascular lesions. So as a result, sun damage will respond better when you have those components available. 645, you create heat pretty much in a volume almost across the thickness of dermis, and as a result you get very good collagen remodeling. The reason we also develop sessions 1 through 5 is that you can refer to these sessions that we need to do another treatment of session number 2 or 3 or 1, meaning that we start developing a language of what each session should do, and each one, for example, session number 3 is the most aggressive for sun damage and pigmented vascular lesions. If someone has never had treatments, you start out with session number 1, but if they've had treatments another location, you can start with session number 2 or 3. If in certain cases you want to do only 2 session series, then you can do session number 2 and 3, or you want to do session number 1 and 2, and so on. So you develop a feel for the results as you're doing treatments, and then you can make recommendations accordingly. If someone doesn't have a whole lot of sun damage and they're really interested in collagen remodeling, session 4 and 5 is recommended. Another attribute of this is that because the epilytes or any IPL that does not have a power meter, they lose energy over time. As a result, it's recommended that we take that into consideration. But knowing that, I need to go ahead and really make a case about what's going on with our heads as they're aging over time. The heads that you receive from optogenesis, they're warranted for 12,500 shots. What happens is that the output drops over time up to 20%. In some cases, if the components are not kept up with properly, they may deteriorate faster, but in most cases, just the reflector, flash lamp, internal filter, all of them together, you will see a drop over time. So what that means is if you get the system that has a brand new head or a head that has had some pulses on it, you will see that the new head is putting out more energy. And as a result, there is a variation in how well the energy comes out on each head. There is another variation here. We have an IPL device that has a plus or minus 5% variability, and the head itself has 20% variability. So by the time it's all said and done, you have approximately 20 to 30% variability in the output power that you're delivering. The system may say exactly 38 joules per square centimeter. However, it may be delivering up to 20%, higher or lower. What we have developed is the means of skin calibration, which takes the machine variability and the head variability into consideration. And what that is when you put the head into the machine and turn it on and you're doing the treatments, when you put the treatment and you fire it using a pulse, a button that we have here, the tissue response is an indication of how it has interacted with the light that was delivered to it. We assume that you have dialed in your proper filter type. Having said that, the machine has dialed so much energy out, and once you put it on the skin and give a pulse, within so many seconds you begin seeing erythema develop. Erythema development is critical in gauging how well the treatment outcome is going to be. What we have found clinically and scientifically is that 10 seconds is the optimal point to get very good results on a large, better than 80% of your patients. The 10-second time is divided up into smaller categories. There is a category between 1 to 5 seconds that if you develop erythema within less than 5 seconds, you're being way too aggressive. You need to take care of that spot you've treated and have gotten this response that fast, and make sure you put in the kinds of medication to protect it best. 5 to 10 seconds is typically aggressive zone. What that means is that you will be able to get treatments, but this is really a range that you're delivering more energy than what the system is typically capable of accepting. Excuse me. 10 to 20 milliseconds is in the low or less than optimal. It may be in situations that you want to be more gentle to skin and not cause too much damage for any reason, whether that person is scheduled to do something that you do not want that treatment to have a specific response showing right away. 20 to 30 milliseconds is the range that when you're doing multiple shots to the same area, you want to be in that range so that erythema does not become your barrier, so you can do more than one pulse to the same area. Typical 10 seconds for skin types 1 through 4 after you give a pulse, you will see within 10 seconds, that's when visibly you can see erythema develop. For skin type 5s, usually because you have the epidermis barrier, it's harder to see through epidermis what erythema is developing underneath it. So you may have to do 3 pulses right next to each other, and by the time the 3rd pulse is done, given that you have 3 seconds between each pulse, then you begin to see erythema develop. So if you can't make your determination by a single pulse, then you may have to do 3 pulses and find out if the response is there. Typical area that you do the test for the face is near the ears. And you got to remember that for people who drive, the left side of the face usually has more melanin than the right side. And in fact, you will see that if you do the calibration on the right side and you do treatment, sometimes you can see that epidermis has reacted on the left side, but on the right side it has been almost no reaction. Once you give a pulse, typically, what you need to duplicate exactly how you will be doing this as you start doing treatments. We have developed what's called a 1-second rule. 1-second rule is about leaving the sapphire on the skin 1 second before pressing the button to deliver the light, and after the light is delivered, leave it another second. The reason for this is when you do a 1 second, you get the maximum comfort, but that's exactly the length of time you have for a 3-second system, that you leave 2 seconds for cooling and you have 1 second to move the crystal to a new location. So that fits well within the 3-second delivery of the IPL pulses. The 1-second rule is what you also want to do as you're doing the calibration. So when you're doing the calibration, you will put the gel, put the sapphire in the skin, leave it 1 second, give a pulse, leave it another second, then remove it, remove the gel, and observe. This manual has been developed with a number of topics that we have talked about. This is a good manual for office staff to read and get a familiarity with what is photofacial. It talks about different settings, and basically everybody starts developing the same language that they talk to patients when you're dealing with photofacials or rosacea cases and what is IPL and so on. So I highly recommend reading through the manual. And also there are some forms, whether it's a patient medical history or some forms that will help patients understand what is the before and after treatment regimens, and some suggestion for consent forms that you can incorporate into your existing forms and documents that you have. Now I'm going to talk a little bit about hair removal. The hair removal, as I have mentioned before, also comes in the same series of having session number 1 through 5. Typical setting, you have the skin type 1 through 6. And obviously for photofacials, most patients who have skin type 6, they don't seek photofacial treatments. So we have not included that in the manual. But for hair removal, skin type 1 through 6 is addressed. For coarse hair and fine hair, and the settings are much more aggressive compared to the traditional settings that Epilyze or Vasculize recommend using just the gel. By the time you get to 5th session, you are within the thermal relaxation time of the hair that you're trying to treat. The temperature of the cooling is here. The typical setting is here. And if you have a device that can calibrate itself, you always use the first row, the top row. However, all these energy settings will vary after you do calibration of the skin. the concept of calibration of the skin is very extensive. That with the cooling, with the setting, you are trying to dictate how much energy is the maximum comfortable energy that you want to give to that skin. Once you're doing that, let's say for face, for the facial, you typically try to do it in areas that you do not have any lesions. And as you move into areas that have lesions, the lesions become a target. The same thing is going on with hair removal. You want to do a calibration of the skin just outside the area that the hair follicles are located. And obviously, if you're doing a facial hair, you want to do the calibration on the face. If you're doing bikini line or legs, you want to do the calibration in that area. Once you establish what energy level is the maximum that you're comfortable delivering to the skin that does not have the lesions in it, once you move into areas that have lesions in them, then the lesion become your target. With this technique, we have shown that there are a number of areas that typical lasers that haven't been able to do the treatments of hair, we have been able to successfully treat those areas.